Did you know that there are around 3,000 hip and knee replacements done each year by the orthopedic surgeons in the Winnipeg Regional Health Authority? The trend over the past 7 years shows that 62% of the patients having knee replacements and 55% of patients having hip replacements are women. We are exceptionally grateful that the Shoppers Drug Mart on Concordia Avenue, through their fundraising with focus on women's health, has supported the development of this exercise video. Their contribution expresses their dedication to women's health and the health of our community. Thank you, Shoppers Drug Mart Concordia. Welcome to the WRHA Surgery Program exercise video. As a patient waiting for a joint replacement, exercise is an essential part of optimizing your surgical outcome. This video is meant to provide a comprehensive guide of the basic preoperative exercise program. You can choose to follow along with the program on a daily basis or use it to check that you are performing the exercises correctly. In this video, the hip and knee exercises shown focus on strengthening the side of your surgery, which will be referred to as your affected leg. However, it is important to strengthen the non-surgical side as well. A few repetitions of each strength and range of motion exercise will be shown to demonstrate proper form and suggested holds. Pause the video after these repetitions to complete any additional repetitions based on your tolerance. One example of each stretch will be demonstrated. Pause the video after each stretch to complete the additional repetitions suggested. It is important to work at your own pace with any exercise. If you are just starting out, it is better to start small and build up. You may start with as little as 5 repetitions once a day. You can gradually increase the repetitions and sets as tolerated up to 3 sets of 10 repetitions. Remember, pain is your guide for exercise. It is normal to have some discomfort when exercising a hip or knee with arthritis. However, pain that lasts longer than 2 hours after completing the exercises or excessive swelling are signs you may have overdone it. You can always reduce how often and/or how many repetitions are done to keep your pain at a manageable level. Remember, any exercise you can do in preparation for surgery is beneficial. Equipment required. For the bed exercises, you will require a 6-inch towel roll and potentially a garbage bag to assist with the range of motion exercises. You may also want to have an additional small towel or pillow available. For the chair exercises, ensure that the chair you use has arms, is stable, and provides support to the entire length of your thigh when you sit back in the chair. The standing exercises require the support of a stable surface, such as a counter or the back of a chair. Ensure the height of the surface chosen allows you to feel stable and supported, but is not too low or high to cause you to have an awkward posture. Pre-op knee and hip exercises. Range of motion exercises. The first series of exercises will look at the range of motion or movement of your knee and hip. These exercises are important to start prior to and continue after surgery to ensure the best possible movement in your joints. These exercises should be performed daily. Knee, hip, range of motion, bed. The first range of motion exercise will be completed lying on your back. Keeping the foot in contact with the bed, slowly slide your foot up the bed, bending the hip and knee as far as you are able. Then slowly slide the foot back down to the starting position. If you are finding there is resistance from the bedding, try using a garbage bag under your foot to decrease the resistance. Remember to only go as far as you can comfortably. Hip abduction. The next range of motion exercise involves hip abduction, or moving the leg out to the side. Lying on your back, Slowly move your affected leg out to the side as far as you can comfortably, and then slowly bring it back to the starting position. A garbage bag on the bed can decrease resistance with this exercise, reducing the stress to your hip. Remember, your toes should remain facing up throughout this exercise and your knee straight. Basic hip and knee strengthening. The next few exercises focus on basic knee and hip strengthening. By working on the strength of the muscles surrounding these joints prior to surgery, you may have less knee or hip pain prior to surgery and be better prepared for the recovery after your joint replacement. These strength exercises can be completed daily. If you have added weight or resistance to any exercise, you should take a day off between to allow your muscle to recover. Isometric quadriceps. The first exercise is for the quadriceps, which is the large muscle group located on the top of your thigh. The exercise involves pressing the back of your knee down onto the bed, causing the quadriceps muscle to tighten. Hold this muscle contraction for a count of 5 seconds. If the position with your leg flat on the bed causes increased pain or stress at your hip or knee, try using a small towel roll under your knee to press into. This may ease some of the discomfort. Isometric hamstrings. The second exercise focuses on the hamstrings in the back of the thigh. For this exercise, you will lie on your back with your affected leg bent slightly. Your heel should be on the bed and the toes facing up at the ceiling. Push your heel down into the mattress. You should feel the muscle on the back of your thigh get tight. Hold the contraction for 5 seconds and then slowly release. Isometric glutes. The third strength exercise focuses on the glutes, or the muscles in the buttocks area. For this exercise, you will lie on your back with your legs straight out. Squeeze your glutes or tighten your buttocks. Hold the contraction for 5 seconds and then slowly release. Knee extension over a roll. The fourth exercise is completed lying on your back with a 6-inch roll placed under the knee of your affected leg. Keeping the knee in contact with the roll, slowly raise your heel up off the bed until your knee is as straight as possible. Hold 5 seconds. Slowly lower the heel back down to the starting position. Throughout this exercise, keep your toes pointed up at the ceiling to increase the quadriceps contraction. Bridge. The fifth strength exercise is the bridge, or lying hip extension. For this exercise, you will be on your back with both knees bent so your feet are flat on the bed. Have your hands on the mattress beside you. Lift your hips up off the bed as far as you are able. Hold 5 seconds and then slowly lower the hips back down onto the bed. It is important you do not hold your breath during this exercise. Straight leg raise. The sixth exercise is the straight leg raise. For this exercise, you will be lying on your back with your unaffected or good leg bent, so the foot is flat on the bed. The purpose of having this leg bent is to support your low back. Keeping the affected leg as straight as possible with your toes pointed up, slowly raise the leg up until your heel is about 1 foot off the bed. Hold 5 seconds and slowly lower. Knee extension. The seventh exercise focuses on strengthening the quadriceps muscle. You should be seated on a solid chair that supports the entire length of your thigh and allows your feet to be in contact with the ground. Slowly raise your foot up until the knee is as straight as possible and the toes are pointed at the ceiling. Hold 5 seconds and then slowly lower back to the floor. Hamstring curl. The eighth exercise focuses on strengthening the hamstrings muscle. You should stand holding on to something solid for support that allows you to maintain good posture. Standing on your good, unaffected leg, slowly bend your affected knee to bring your heel up towards your buttocks. only go as high as you can comfortably. Make sure to move through this exercise slowly and only start with a slight lift behind until you find the range that is comfortable for you. At the top of the movement, hold for 5 seconds, and then slowly lower the foot back down to the floor. To ensure you are focusing on the hamstrings, you should also make sure the knee of the affected leg is pointing at the floor and that your thighs are side by side. Hip flexion. The 9th exercise is going to work on hip flexion, or bending, and is done in a standing position holding onto a solid surface for support. Standing on your unaffected leg, slowly raise the affected thigh up, causing a bend at the hip similar to a marching motion. At the top of the motion, hold the position for 5 seconds and then lower the foot back down to the floor. Hip abduction. The 10th exercise works on hip abduction. Standing at a counter or stable surface for support, stand on your unaffected leg and slowly raise your affected leg out to the side. Try to keep your toes facing forward and make sure your hip isn't hiking up to increase your motion. Your hips should stay level throughout this exercise. At the top of the motion, hold 5 seconds and then slowly lower the leg back down to the starting position. Hip extension. The 11th exercise focuses on extension of the hip or lifting the leg to the back. You will be standing on your unaffected leg with the support of a stable surface. Slowly raise your affected leg behind you with your knee straight as far as you can without bending forward or arching your back. Hold at the top of the motion for 5 seconds and then slowly lower the leg to the starting position. Mini squat. The final exercise is the mini or partial squat. For this exercise, you should stand holding onto a stable surface with your feet about shoulder width apart. Slowly bend your knees, bringing your hips back as if you were going to sit in a chair. Lower down only as far as you can comfortably. Hold 5 seconds and then slowly return to the standing position. Make sure your knees do not come forward past your toes during this exercise. If you find this difficult or are unsure of your abilities, position a chair behind you. Knee and hip stretches. The next 3 exercises are stretches for the main muscles that cross your knee and hip joint. By increasing the flexibility of these muscles prior to surgery, you will allow for an easier return of range of motion after surgery. Stretches are best if performed daily. The goal is to stretch each muscle group for 1 minute. We will reach this goal by stretching each muscle for 30 seconds and repeating the stretch 2 times. Hip flexor stretch. This stretch is performed in bed, lying on your back. Your surgery side or painful leg will remain flat on the bed. Your non-affected side will have the leg gently pulled up toward the chest with your knee bent. It is important the sore leg remains flat on the bed and does not become bent at the knee. If you have some tightness in your hip flexors, you may feel a pull along the front of your hip or upper thigh. Hold 30 seconds. Do not try to stretch your good leg by pulling your sore leg up to your chest. This causes increased stress to your hip and could increase your overall pain. Hamstring stretch. The hamstring stretch can be performed sitting in a chair. You will need to sit at the edge of the chair to allow your knee on the leg being stretched to be as straight as possible. Start with your leg elevated slightly, for example on a stool or another chair positioned in front of you. Slowly bend forward over your straight leg until you feel a stretch in the back of your thigh. This should be a comfortable stretch, not painful. It is important to try to focus on keeping your back straight, which allows a more effective stretch of this muscle. Hold 30 seconds. Calf stretch. The gastrocnemius, or calf muscle, can be stretched in a standing position. Stand with your hands supported against a wall or higher surface. Separate your legs into a slight lunge position as shown. It is important that the front leg is bent and the back leg, which is your affected leg, remains as straight as possible. Slowly increase the bend in the front leg until you feel a strong stretch in the calf area or back of the lower leg on the straight leg. To decrease stress in the front knee, make sure your feet are far enough separated so the knee is not driven out past the toes. Ensure the heel on the leg's straight back remains down and that both your feet are pointing straight ahead. The back foot may have the tendency to turn out during the stretch, so check periodically and adjust as needed. Hold 30 seconds.